Okay, hi everyone. We're about to get started. It's just going to be Dr. Yaffe today, and we're going to do half an hour, one question, one follow-up. So I'll turn it over to her now.
Thanks very much. Good afternoon. Dr. Williams is currently at other meetings, so I'm going to be providing the update today. With that, I'm going to get right into the numbers and then move on to the questions. We remain cautiously optimistic as the trends we are seeing are continuing to improve. Our case counts have been increasing at a rate of 1.5 to 1.8% per day over the last 5 days. And for the week of May 3rd to the 9th, the effective reproduction number is lower than 1 across the whole province, including the City of Toronto. These are very encouraging trends, but of course we need to see this continue a little longer. Today, we have a total of 21,236 confirmed cases of COVID-19 that have been reported in the province of Ontario. This is an increase of 329 cases, or 1.6% since yesterday. Of our cases, over 57% are in women, 43% are in people 60 years of age and older, and 62.4% are people who reside in the Greater Toronto Area. The number of healthcare workers who have tested positive for COVID-19 is 3,562, which is about almost 17% of our cases. Again, this is a cumulative number, and it's not representing those currently positive. On a good note, we have almost 75% of our cases are considered resolved, which is 15,845 cases. We have 1,018 people currently in hospital, and the number of people in ICU is 189, of which 144 are on a ventilator. These numbers are all going down slightly. And sadly, we do continue to see deaths from COVID-19. To date, a total of 1,765 deaths have been reported, which represents an increase of 40 from the previous report. With respect to long-term care homes, the Ministry of Long-Term Care is reporting 180 active outbreaks in long-term care homes. 1,269 deaths have been reported among residents of long-term care, and now a total of 5 deaths among staff have been reported. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 71 homes are in outbreak, and 169 deaths have been reported. In terms of laboratory testing, a total of 475,058 tests have been completed in Ontario. In the last day, 15,137 tests have been done, and we have 13,395 tests currently under investigation. Okay, so overall, as I said, the trends are looking quite good, and I'm going to just turn it over now for questions. Thank you.
Okay, we'll go to the phone lines.
First question comes from Nicole Lampa from CTV News Kitchener. Please go ahead.
Hi, Dr. Yaffe. The province says there's lab capacity right now to do more than 20,000 tests daily in Ontario, but the public health unit here in Waterloo Region said today there is a discrepancy between what the province says is possible versus the reality on the ground. They said they are unable to test at the level they want to or expand testing to the general public right now due to this lab capacity issue. What is being done to address this and ensure local public health units are able to increase the number of tests done each day?
Thank you for the question. So, first of all, I think it's important to note that we have developed a lab network in Ontario of, I think, close to 25 laboratories, including the public health lab, hospital labs, and commercial private labs. And this has been developed over a period of weeks, where normally this kind of thing takes years to develop. So certainly if the health department's experiencing issues, we do speak with the health department, the medical officers and associate medical officers. We have twice weekly routine calls, as well as obviously they can contact me for any issues as they wish, and we would work to resolve them. But I think it's important to note that yes, overall we do have a capacity now in province of Ontario of over 20,000 tests a day. And sometimes those tests have to be moved from one lab to the other. So I think the bottom line is if they are experiencing issues, they should be contacting me or someone else at the ministry to work to resolve those issues. But we are very confident that our capacity is over 20,000 and it's growing.
Follow-up?
Is this the first that you've heard about a lab capacity issue, or is there a specific lab capacity issue here in Waterloo Region?
I mean, from time to time we hear, certainly since it's, as I say, a relatively new network, we have had certainly, I know, issues around couriers on the weekend with some of the commercial labs, which have been sorted out, issues around different labs. You know, it's a relatively new network, and we work with, I mean, I welcome people letting us know if there's an issue so we can address it. But it's been going very well, and I do have to say, I congratulate all the health departments for the great work they've been doing coordinating the testing for long-term care facilities. It's been a huge amount of work, and working with Ontario Health and others and the laboratories to get through thousands and thousands of tests. It's been really good.
Next question.
Next question comes from Mike Crawley from CBC. Please go ahead.
Hi, Dr. Yaffe. I just wanted to talk about the targets that Ontario set around entering stage one of the reopening. In particular, the targets about testing and about being able to trace the contacts of infected people. What evidence is there, you know, given that tomorrow the Premier is going to announce the details of the plan for entering stage one? What evidence is there about how Ontario is doing on hitting those targets or for being ready to reopen the economy?
We are very closely monitoring the targets and all the measures, and they come to the command table and are discussed. And we do continue to provide advice to the government. It's not like black and white where you'd say, okay, it reaches a certain number and you turn the switch. We are looking at the trends, and the trends, as I said, are quite promising. I think in terms of the specific thing around contact follow-up, now that the health units are almost completed all the testing in long-term care, we are asking them to focus more on case and contact follow-up. And we know that already the vast majority are following up cases in less than 24 hours, close to 100%. But we also want to have less cases where we don't know where they got it, where there's no epidemiological link. So delving harder into those. And so that's where we're looking to do some more work. But in general, I think that the trends are very positive, and we'll have to see where it goes.
Follow-up?
Yeah, just specifically then on the testing, the criteria that was laid out in the framework said to have ongoing testing of suspected cases to detect new outbreaks quickly. How do you measure that? How do you tell whether the testing capacity is adequate to be able to detect new outbreaks quickly?
We are actually working on a new lab testing strategy now that the long-term care homes are almost done, and which will be probably announced in the next few days. And so that we will be able to better identify any beginning of a problem, and looking at various ways to identify where a person might have been. Certainly if we start to open up things, Right now, people wouldn't have very many contacts. Hopefully, they've been social distancing, they've been staying at home primarily. But if they're going out, we need to have a better idea of where they've been and who they've been around, and making sure that we have the testing capacity to test those people. So, this, as I say, the strategy will be announced in the next few days.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Dr. Yaffe. My question is about elderly people in long-term care, and many families are having great difficulty communicating with them, and a lot of them have dementia, Alzheimer's, and are very confused as to what's going on. Are you worried about the mental health toll this is taking on long-term care residents? And would you consider allowing relatives to go see homes that perhaps don't have outbreaks?
Absolutely, I'm concerned about the mental health of seniors in long-term care homes. I can certainly relate to this because during SARS, my mother was in hospital, and I was unable to visit her, and it certainly was difficult for her. It was difficult for the family. It was difficult for me. So I can understand how difficult the situation is for everyone. We are doing our best, working together with the Ministry of Long-Term Care, Ontario Health, Public Health Ontario, to reduce any risk in long-term care homes. And the data that I've seen shows that we have categorized them into red, green, or yellow. And the number in the red, the high risk, is going down. The number in yellow is going down. So overall, things are getting better. The testing we've been doing, where we're looking forward to seeing the results, hasn't identified too many new outbreaks, which is good. Making sure that the infection prevention and control is optimal. Making sure that they have enough staff. There's lots of issues that we want to make sure are addressed so that we don't have more outbreaks and more deaths, that they're prevented. So absolutely, it's important to consider the mental health of the people in those homes and the social isolation they've been experiencing and the difficulties for the families, but we also don't want people to get sick and die. So it's a balance, and it's definitely on our minds, and we're looking, as we continue to work with them, to hopefully be able to allow more visiting.
Follow up?
Thank you, Doctor. My follow-up is for people who are immunocompromised. There are so many, whether it's cancer patients, people with cystic fibrosis, the list goes on. When the economy starts to open, what does that mean for these people? Are they going to have to remain in isolation until there is some sort of shot that they can take?
You're talking about a vaccine, and that's probably going to still be quite a while. I don't think it's realistic to think that they will have to stay home for all that time. I don't think people would want to do that. Or, I think people who have underlying health conditions, particularly immunocompromised people, will have to take special care with social distancing. And if they can't social distance, to consider, recommend wearing a mask, a cloth mask. Keeping their general health good, and good hygiene, good hand hygiene, trying not to be around people who are sick, and not going out if they're sick, and general health, good sleep, good diet, making sure they're under proper medical care for their condition, and taking their medications as they're supposed to. So I think those are the main things they'll have to do. And hopefully there will be a vaccine sooner than later.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Doctor. I was just wondering if you could say how much testing is going on now. Say what percentage of testing is going on now outside nursing homes and congregate care.
Hey, Rob, we're having trouble hearing you. Hey, Rob, we're having a little trouble hearing you. I don't know if your phone's on speaker.
Sorry, can you hear me better now?
Yes.
Sorry. I think I held the phone down a little bit too low on my face. Doctor, how long will it be before you get through all the congregate care, not just nursing home testing, but retirement homes and whatnot? I'm assuming that won't take as long. And how much community testing are you doing now?
Well, as I mentioned, we are looking at the testing strategy, and now that we're close to completing long-term care homes, and we'll be announcing a different focus in the next day or two. You're right, retirement homes are another congregate setting that's of concern. We're looking at criteria, which ones would be more considered high risk, which ones are having outbreaks, and there are other congregate settings. At this point, people in the community, certainly we'd encourage, if you have symptoms, contact your doctor or telehealth or your health department, and they will advise you on whether you should get testing.
Follow up?
Yes, thanks, Doctor. When we go to the broader testing, are you going to be pinpointing certain segments of the economy that you need to keep tabs on, such as, for example, grocery store workers or pharmacy workers, or any other segments that are out there or are going to be emerging as other businesses open up, so you can have snapshots in certain areas?
That's an interesting question. I don't think I certainly haven't considered that as a target group, but I think that we were looking more at vulnerable groups and people who are more at risk of serious complications, rather than looking at groups that might have more exposure, but it's something to consider.
Next question.
Next question comes from Siobhan Morris from News Talk 1010. Please go ahead.
Hi, Dr. Yaffe. I'm hoping that you can expand on the direction that was given today around multi-system inflammatory vasculitis and what that changes for clinicians and parents.
Sure. So that is a syndrome that's similar to Kawasaki disease, and it's been seen in children in Montreal and New York and I think Italy. At this point, we haven't had any cases reported in Ontario, but pediatricians have been advised about it. It's a syndrome that's not very common, luckily. It's a kind of a presentation in older children that may be associated with a viral or bacterial infection with inflammation. And it can happen several weeks or a month after the original infection. So at this point, we don't know if it's actually associated with COVID-19 or not. It's temporally associated in some of the clusters. So we are asking physicians to report. It's been added to the case definition. And if they're concerned, certainly the Canadian Pediatric Society has sent information out. It's a rare condition. Most children have a very mild infection, may not even know they have it, but it's something we need to look at. And it's something where the child will get a persistent fever, a rash, they might get nausea, vomiting, diarrhea, abdominal pain, and it can be treated. If it's not treated, they can end up with cardiac issues. So it's a serious condition, and that's why we made it reportable. Made it part of the case definition in Ontario, and we'll keep monitoring very closely about whether we get any cases.
Follow up?
And is that the major change then, just that there's a central way then to report and to track whether or not, because we know that pediatricians had been keeping an eye out for this sort of thing for a couple weeks now.
Yes, we've added it to the case definition for COVID-19, and we're keeping in touch with what's going on in the field. That's really it. And we'll wait and see. Hopefully we won't get any, or if we do, very few.
Next question.
Next question comes from Richard Warnicka from National Post. Please go ahead.
Hi. There was a study that came out of New York recently that showed something like 65% of new COVID hospital admissions there came from people who had acquired the virus at home. I wonder if the public health is considering or is planning anything around supported isolation to give people who can't isolate away from their families at home somewhere to isolate until they can recover.
You were a little muffled, so I think what I heard you say is there was some report in New York that 55% of cases acquired the infection at home. So is there some way of isolating them somewhere else? Is that correct?
Yeah, that's basically, yeah, supported isolation.
Yeah. We certainly with individuals who are homeless or underhoused, I know that the local public health units have worked with the housing and hotel authorities to place individuals in a different setting where they can actually isolate, because it's very difficult to do so, obviously, in a shelter. Other than that, I think if we would take it on an individual case-by-case basis. The health departments do provide specific advice to the case around how to isolate, and how to make sure they don't eat together, and how their laundry's dealt with, and those kind of specific details. And generally speaking, it hasn't been an issue that I'm aware of, except for in the homeless population, but something we always are looking at.
Follow up?
Yeah, I've seen that advice, and from what I've spoken to, people I've spoken to, it's only really practical for people who have large homes with multiple bathrooms and places where people can isolate away from their families. I just want to be 100% clear. There isn't any advice now for, say, a family living in a one-bedroom apartment or a small rental.
I'm not aware of any specific advice, but again, the local public health department would be working very closely with the case, and determining what kind of conditions they live in and how feasible it is for them to actually do what they should be doing. And if they can't, then they should be looking at alternate arrangements.
Next question.
Next question comes from Alistair Sharp from National Observer. Please go ahead.
Hello. I just wanted to follow up about the Kawasaki-like disease that you're now adding to the case description. I'm just wondering what impact that may have on recommendations for when schools may reopen. Yeah.
I have to say I don't think it would have any impact, to be honest. I think that, first of all, as I said, it's a very rare complication. It happens usually several weeks or a month after the acute infection. In fact, the child might not even have had any acute symptoms. And when they develop this, it's as far as I know, it's not infectious at this point. So that it is not related to the decision around school opening.
Follow up, and this is the last question.